Hello, everyone. I'm Leslie Verner, and on behalf of Carolina Breast Friends, I would like to welcome you to today's session on integrative medicine. Our speaker is Dr. Russ Greenfield, who is the Director of Integrative Medicine at Novant Health. When caring for his patients, Dr. Greenfield treats the whole person, the body, mind, spirit, family, community, and environment. He was trained by Dr. Andrew Weil, who is considered a pioneer in the field of integrative medicine. In today's program, we will be discussing healthy diet and lifestyle practices and select complementary therapies that may help you. It is an honor to have Dr. Greenfield with us, and I will now turn the program over to him.
Leslie, thank you very much. And to everybody, thank you so much for offering me time to speak with you. I want to be certain that I serve well. And what I mean by that is oftentimes people come into presentations about integrative medicine with some select questions. And I hope that in this brief presentation that I will be able to answer many of them. And if not, I hope that you will raise the questions at the end, or even if you're afraid that you might forget them, put them in the little group chat and we can go over them towards the end, because the most important thing is to answer your questions. I find myself in this very fortunate position of being an integrative medicine physician. So my background, you should know, is as a conventional physician. I attended medical school in Chicago, trained in emergency medicine out on the West Coast at Harbor UCLA, did additional fellowship training there, and initially went into academic emergency medicine just across the way at what was then Carolinas Medical Center. I then moved over to Presbyterian Hospital, was the director of the emergency department at Presbyterian Hospital in Matthews when it first opened back in the early 1990s. But in the late 1990s, I was extraordinarily fortunate when I was accepted into the very first class of what's called the program in integrative medicine at the University of Arizona College of Medicine with, as Leslie said, Dr. Andrew Weil. Now, it's important to understand what integrative medicine is and what it isn't before speaking about some of the things that might help you and all of us. We define integrative medicine as healing-oriented care. It takes account of the whole person. So certainly it's body and mind and spirit, but it's also family and community and environment. My peers and I define health as balance. Now, balance shifts day to day, moment by moment. So really what we're speaking about is resilience. And if one area falls out of balance, let's say physically we become ill, if all the rest of what makes us unique, spirit, family, community, and so on, if all those areas can be optimized and maintain balance, it's going to help that initial area that fell out of balance hopefully come back into balance. We are indivisible systems. So whereas in conventional medicine, we might often talk about, well, we have our digestive tract and we have our nervous system and we have our skin, and we talk about them as separate entities, we are indivisible systems. And so that balance, the way that our different systems interact with one another, how we interact with our environment and our loved ones and our work and all that's going on with us is really, really important towards overall balance, which means it's really important towards overall health. So when I speak with you this evening about things like diet, about vitamins and supplements, about select complementary therapies, please understand it's going to be a fair bit of information, not all of which would I want you as unique individuals to participate in. When people come to see me as a patient, I often tell them that there are anywhere between 3 and 25 different things that any one of us could be doing to optimize our health or our well-being. If I were to offer any one of you 12 to 15 different things to do, number one, we're going to get you crazy stressed out. And number two, you can't do any of this, all this stuff altogether anyway. So we ask people to be gentle and kind with themselves, moving forward with optimizing health and well-being, with a focus on perhaps 1 or 2 things that might resonate with you that when we speak this evening, maybe adding a third in a couple of weeks, maybe exploring something a little bit more, a little farther down the road, but being gentle and balanced in the way you take care of yourselves. I will share with you something early on that I usually share towards the end of meeting with patients, is that I learned something along the way from my patients, not in med school, internship, residency, 2 fellowships, no, from my patients. And that is that the centerpiece of healing is kindness. However, in this regard, it is kindness towards ourselves. We often equate that sense of kindness towards ourselves with selfishness, and that is not what I am speaking of. It's really the rare individual who is truly selfish. But it's very commonplace for people not to be very good or kind towards themselves. And so what I would ask each of you to consider is there a way that you can be just a little bit more, not selfish, but act in ways that are a little bit more self-sustaining? Are there ways that you might build in a little bit more cushion? Are there ways that you could be a little more gentle with yourselves? Is there a way that you carve out a little bit more space for you to heal rather than jumping right back into the rat race of all that you were doing? Are there ways that you can take better care of yourself and see your value in the mirror and understand that you actually not only deserve this, but that it's actually good for everybody around you as well? We speak about this in many different ways and with regards to stress management, which we're going to talk about in just a little bit. But first, if you don't mind, I would like to speak with you about diet, about nutrition, because there's so much information, misinformation out there on the internet, and it's enough to drive people crazy. Once a diagnosis of breast cancer or any kind of serious illness is broached, the information that is available turns into information overload, oftentimes very quickly. Physicians are giving information in their greatest sense of trying to help people, but it's a lot of information. The dietitian, the nurse, we go onto the internet, there's all kinds of stuff saying, do this, don't do that. There are people who feel like they can't speak with their healthcare practitioners about complementary alternative therapies. And so one of the important things about integrative medicine is oftentimes many other people are stuck in this equation of either or. Either we're going to do conventional medicine or we're going to do this complementary alternative stuff, but I can't talk to either side about these two things because they don't understand. So I can't talk to my conventional medicine doctor about vitamins and supplements because they haven't been trained. I can't talk to my herbalist about conventional medical therapy because they don't know. So we're stuck in that space and it's not comfortable. So we in integrative medicine try and take that either or and make it and. How do you use the best of conventional medicine, the best that science offers, together with ways that we can engage our own innate capacity to heal through diet, lifestyle, and even select complementary therapies that have been shown to be effective and safe? So let's start by talking about food. So first things first, one rule to lay down. For a diet to truly be healthy and health promoting, the very first thing it has to be is tasty and satisfying. Because if we are participating in a diet that is not satisfying, ultimately it's not going to work and we're not going to hold to it long term. The second rule to keep in mind from my perspective is not only are splurges, occasional splurges okay, my peers and I recommend them. Remember that food should be a source of joy. It should be a source of sustenance, not only physically, but emotionally, spiritually, and communally as well. So I kid around with folks, but it's true. If tonight is the night for pizza and Haagen-Dazs, have a blast. And say, okay, I know that might not have been the healthiest meal in the world, but I was together with my loved ones. We had a really good time. I had fun. It was worth it. I'm going to eat healthier for the next week or so. That's great. That occasional splurge gains you opportunity to become more social, to dispel some degree of fear, to participate in life because food is part of that joy. So we don't want the food to be a source of fear, which it often is when you go onto the internet. So speaking of that, let's talk about sugar for a moment. Because if you spent any time on the internet looking, how should I eat? How do I prevent recurrence? How do I take care of myself during treatment? You will often see this statement that sugar feeds cancer. Well, indeed, interestingly enough, sugar does feed cancer. But sugar also feeds all the healthy cells in the body. So it feeds our brains, our hearts, our livers, all different cells in the body. So it's not that sugar is inherently evil. It's simply that we eat a little bit too much of it. Specifically in the type of food that is highly manufactured or highly processed. Most of these bagged and boxed foods that are high in carbohydrates are ultimately not that good for us because what happens? When we eat a food that causes, let's say, our blood sugar to go up relatively rapidly, that's called a high glycemic index food. You don't need to know the term as much to know what happens in the body when we eat these foods. So let's say we're eating some cake or cookies or something that we really enjoy. When we do that, our blood sugar rises relatively quickly. When that happens, insulin levels also rise. Insulin is a hormone that's used by the body to take sugar, drive it into cells where it can be used as the energy for the cell to run its machinery. So again, glucose, sugar, is really important for proper functioning of cells. But when we eat a lot of it, or if we're just eating foods and our blood sugar goes up and then our insulin levels go up, over time, our bodies become a little bit more resistant to insulin. And so all of a sudden there, what happens is that blood sugar levels are staying up a little bit more than they should because our body's becoming a little bit more resistant to insulin. The body says, well, I need that energy source. I know what I'll do. I'll just store it as fat. And ordinarily, many years ago, 15 years ago, we thought that fat was just sleepy. It was just sleepy fat. It didn't do anything. It was just something we wanted to get rid of. As it turns out, body fat, especially when it's around our abdomen, so-called visceral fat, is very active. In fact, many specialists equate it to what we call an endocrine organ. Why? Because fat sends out all these different compounds, things like cytokines, which increase inflammation in the body. Cytokines not only increase inflammation in the body, but they make it so that the body becomes even more resistant to insulin. So it can build up even more fat in the mid-abdominal region. And that visceral fat drives inflammation. Why is that important? Because many people who study cancer believe that untoward inflammation actually drives cancerous change. So understand, first of all, that inflammation under ordinary circumstances is a very important component of a properly functioning immune system. If we were to accidentally scratch ourselves one day, within just a few moments, that area becomes a little bit swollen, a little bit red, maybe a little bit itchy. Those are all signs of actually normal inflammation, actual normal inflammation. Over a couple of days, the wound heals, everything is gone, and it's like it never happened. That's part of the inflammatory response to injury, to damage. But when inflammation sets up shop where it didn't need to be in the first place, or if it persists longer than is necessary, that inflammatory response may cause damage to otherwise healthy tissues and cells. And that's where a lot of researchers think that some cancerous change begins with untoward or persistent inflammation. Why start by talking about diet? Because it's one of the most important ways that we can minimize untoward inflammation in our bodies. One other thing to keep in mind about blood sugar and insulin levels is when blood sugar goes up and insulin levels go up, so do some other factors that are not good players, including something called insulin growth factor 1, or IGF-1. When IGF-1 levels go up, there are certain pathways that are activated that again look like they may contribute towards cancerous change. So to go back and talk about sugar again for a moment, remember that carbohydrates are necessary for our health, but there are carbohydrates like whole grains and carbohydrates like other types of healthy fare, and then there's white bread and sugar, all of which are okay in small amounts. But generally speaking, you want to stick with the carbs like vegetables and fruits and whole grains that are really good for you, and not take in quite so much of the highly processed carbs themselves. So if you eat a couple of potato chips one night, it's okay. If you have a piece of cake one evening, it's great to celebrate. But if you're doing that on a consistent basis, it ultimately may not be very healthy for us because it may drive inflammation, insulin resistance, and if the body becomes resistant to insulin, it's going to kick out more insulin, which means it kicks out more of those growth factors. So what does an anti-inflammatory pattern of eating look like? The good news here is, generally speaking, it's pretty tasty. It's a mix of Mediterranean and Asian style fare. So in short order, it's really more vegetables than fruit. It's whole grains. It's perhaps more fish than red meat. And it's healthy fats like extra virgin olive oil. You can include sweets like dark chocolate. Every once in a while, a glass of wine is okay as part of a social gathering. Remember, where the concerns about things like alcohol come in is that we do have some research data suggesting that alcohol intake on a consistent basis may increase the risk of breast cancer. But does that mean that you can never have a glass of alcohol? I don't think so. So, ordinarily, when people do not have a history of cancer, the recommendations are that men can probably have a glass of wine each evening, whereas women should probably average out to no more than a glass every other night. Most women then ask me, Russ, well, can I just have 4 on Saturday? That's not really the way we want to go. So an occasional glass of wine, again, is part of the joy of life, and it's okay to do something like that. Again, we don't want food to be a source of fear. We want it to be a source of sustenance and joy. We have really good nutritionists at Novant who actually see things just the way that we do in integrative medicine. Follow an integrative, anti-inflammatory pattern of eating with occasional splurges thrown in, and that's a really good way to take care of yourself. If anybody on the call is in the midst of treatment or knows somebody who is, there are ways to actually use diet to minimize symptoms, or ways that you can eat healthy if, let's say, your taste has changed or your appetite has changed. And so I want to let you know about a book that we often recommend to people. It's called Eating Well Through Cancer, written by a woman named Holly Clegg, C-L-E-G-G. You can get it out of the library. It has some very good, easy recipes and ways that you can use food to help you through treatment and beyond. We actually have a very unique program at Novant Health Integrative Medicine called the Healing Kitchens program. It is free to anybody who is seen through the Novant Health system. And it was put together by a woman named Rebecca Katz, who has written a best-selling book called The Cancer Fighting Kitchen. It is essentially a cookbook. What the challenge with the Cancer Fighting Kitchen is that many of the recipes are quite long. And there's a lot of different ingredients that sometimes are a little bit funky. But the Healing Kitchens program that we have with them is composed of 3 to 5 minute videos, much shorter recipe items, easy to make, healthy fare that's actually really delicious. And I can share that with you because we've had some of our chefs at Novant Health actually make the recipes and serve them at different places in the hospital, and it's really quite delicious. So if anybody is a patient through Novant Health, we can provide you the free link for that. And if you're not a patient of Novant Health, you know what? We can still provide you with the link. It really doesn't matter. We just want everybody safe and healthy. And so later on, Leslie, if anybody might be interested, I will simply share the link with you, and you can share it with anybody and everybody. Because once you sign on, it's free and you can use it forever. And they send out little newsletters and e-newsletters, and it's very useful information. One of the other topics about eating that I want to broach is about soy. Before moving on to talking about vitamins, supplements, and herbs, a lot of people with, let's say, estrogen receptor positive disease are afraid of soy-based foods because there is that information out there that soy is a plant-based estrogen. And indeed, interestingly enough, soy is a estrogen, a plant-based estrogen, but it's also a plant-based anti-estrogen. So the interesting thing when you take a look at statistical or what we call epidemiologic studies, people who grow up in the Far East, in Asia, are usually brought up eating a lot of soy foods, along with a lot of vegetables and a lot of fish, and they have a lower incidence of many of the cancers that we have here in the West, including breast cancer. When those same people move to the West and eat more like we do, their incidence of cancer, including breast cancer, meets the same level that we have here. So people have taken a look at this and saying, what is it that they're eating? What is it that they're doing? Is it soy? Is it not? And we've been concerned because soy has estrogenic activity. But when you take a look and see that people eating a lot of soy from early ages, from childhood, seem to have a lower incidence of hormone-driven tumors, we start taking more and more look at this. Where the theory goes is that if you have an estrogen receptor in the body and an estrogen molecule comes along and it attaches to that receptor, it then activates the receptor and sets off a cascade of events under normal circumstances. Well, a soy-based molecule will come along and also attach to that receptor, but it doesn't stimulate the receptor quite as strongly as the native estrogen molecule might. So it takes up the receptor space, blocks estrogen from actually getting in there, and doesn't stimulate the receptor quite as strongly. So in a premenopausal woman, that soy molecule might actually be protective because it doesn't allow the receptor to be stimulated quite as strongly as might happen with an estrogen molecule normally in the body. But that raises the question, what about somebody who is now postmenopausal? Because this receptor might otherwise remain empty because there isn't as much estrogen floating around. So if we introduce a soy molecule that stimulates the receptor, does that then place the woman at risk? So that's why we were for many years cautious. We said, it's not like you have to avoid soy, but you shouldn't be eating it every day because we're just not sure. But you know what's interesting? Over the past 5 to 7 years, more and more research data has come out suggesting that not only for women who have estrogen receptor positive disease, not only might soy-based food be okay, be acceptable, it might be protective. So now what we recommend to people is that they should not need to be afraid of eating soy. And when I talk about eating soy, I'm talking about whole soy foods. So these are things like tempeh, tofu, miso, edamame, soy nuts, soy milk, not necessarily textured soy isolate or protein isolates like in the veggie burgers and things like that. We're talking about whole soy foods. And my own bias here is to lean organic. Why? Because somewhere between 60 and 70% of all the soy products out there are genetically modified. And to be honest with you, we simply don't know what that means. So my preference is, until we know, let's lean organic. Most of the time, soy-based, whole soy foods are not that expensive. And if you dry them out and then saute them with different sauces, they take on the flavor of whatever they are cooked with, and they can be very delicious and a nice source of protein and fiber. Another thing to talk about there is, what about organic versus non-organic? So the reality is that the health benefits, the nutrient value found in commercial produce is almost exactly the same as what you will find in organic produce. You'll get almost the same amount of antioxidants, almost the same amount of nutrients. So from that perspective, the traditional fare that you can buy at any supermarket that is conventionally grown is fine. Where the distinction comes in is that when you buy organic, you pretty much guarantee that you're not getting genetically modified food, and you're going to get exposed to at least less, I can't say none, but at least less residue of pesticides, herbicides, and fungicides. And where is that concerning? Well, we know that farmers that are exposed to a lot of pesticides have an increased incidence of things like Parkinson's disease. We know that youngsters, when they are exposed to a large amount of conventionally grown produce, they absorb certain compounds that may not be healthy for their central nervous system. What does it mean for us when we're trying to prevent cancer or recurrence and eating organic versus not organic? We're not completely sure. But what I recommend is that if you can afford it, go after at least the frozen organic produce. Because even though it's frozen, you get the same nutritional benefit as buying the organic produce when it's fresh. And you can eat it out of season. So when I talk about that kind of produce, what are the things I'm talking about? Specifically, I'm looking at things like cruciferous vegetables. So broccoli, cauliflower, kale, Brussels sprouts, things of that nature. Why? Because each of those foods contain within them compounds that are known to be cancer-fighting agents. You can buy them frozen and cook them up that way. Conventional is fine, but if you're eating the same food over and over and over again, if it's apple season and you're buying conventionally grown apples every day, you're going to get a concentrated effect of the way that food is grown. And so you might want to lean organic for the food you're eating most often. But if tonight is green beans and tomorrow strawberries and the next day is apples and the next day is squash, whatever, conventional is fine. And frozen is just as good for you and maybe even a little less expensive. Canned produce, we often recommend that people lessen their reliance on, not because the produce contained within might be dangerous for us, but the way the cans are produced might not be in our best interest. So you may have heard about some of the issues around the linings of the cans. And so we are a little bit concerned about that with regards to canned produce that is acidic. And these are specifically things like, diced tomatoes or tomato sauce or tomato soup. Our preference, mainly because of the potential for adverse effects from the lining inside the cans, is to buy those kinds of foods in glass or in frozen packaging rather than in canned packaging. So that's a lot about how to eat and what to eat and all, but it's generally focusing on a lot of what you already know. So it is more vegetables than fruit. The types of fruit we'd like to see eat more of are things like dark berries. So blackberries, blueberries, raspberries, strawberries. Again, lean organic where you can, buy them frozen if you like. They're very tasty and they're really good for you because of some of the chemical compounds contained therein. Most any of the vegetables out there are going to be good for you, but focusing on the cruciferous vegetables can be really good. Broccoli, cauliflower, kale, watercress, Brussels sprouts, all those kinds of foods eaten intermittently can be very good for you. Do you need to juice on a regular basis in order to be healthy? Juicing is a fun, different way to get your nutrients, but there are many eating programs out there that suggest that you need to juice multiple times a week, maybe even 3 times a day, maybe even in some of the alternative medicine programs that are out there, juicing once an hour of 13 hours a day, to which I say no. It's just far too much work, and there's no evidence to suggest that this is actually beneficial for us. Now, if you like juicing, I think juicing once or twice a week is a different way to get your nutrients is fun and fine. Where I get concerned is I see a lot of people who start juicing and they juice a couple of times a week and they say, well, if this is good for me, I should probably juice every day. And then they're juicing twice or 3 times a day, and then they're bringing their juicer with them on vacation, which you don't need to do. So if you like juicing and you like just a different way of getting your nutrients, it's a nice way to do things. It really is. So we will go back over questions a little bit later on. It's a lot of information about diet, but I want to end with one other thing that comes up a lot, which is fasting. So the paleo diet and other diets like that have really hit the market, especially along the lines of like keto diet and stuff. And you'll hear about all these different things, the Hallelujah Acres diet and the Gerson diet. There's all kinds of diets out there. I think you should hold to a diet that feeds you, that nourishes and sustains, and that isn't that hard. So, pardon me, what I mean by that is many of the foods that you like, yes, feed yourself that way because it nourishes you emotionally and spiritually too. The foods that we like that aren't that good for us, make them our treats. Focus on the whole grains, the vegetables, a little bit more fish than red meat. Why? Because fish contains anti-inflammatory compounds like the omega-3s that can be good for us. And all the things you'll read about omega-3 supplements, they are trumped by eating more fish. So if you ate salmon, especially Alaskan salmon or Pacific Northwestern salmon, because it's higher in those omega-3s and it's not farmed. If you ate, let's say herring or sardines or rainbow trout, all of those fish are very high in omega-3s and are relatively clean and good for us. If you were to go on out and you're going to a restaurant and they have salmon, please be gentle with yourself. Do not ask them if it came from Alaska or the Pacific Northwest. Just enjoy it, okay? When you are buying it for your home, look for Alaskan salmon because it's going to be a little bit better for you. But the best way that you can access salmon and keep the price down is to buy canned salmon, because all canned salmon is wild. And so the wild salmon is going to be higher in those omega-3s. It's going to have a little bit better overall nutrient profile, and it's far less expensive than some of the salmon steaks that are out there. So let me end with talking about fasting and things like keto diet and things of that nature. So there's some intriguing data around the ketogenic diet and some of the other diets out there, but I think it's kind of hard. And I don't want people to have to do anything that's really, really hard unless I know for sure that there's a benefit and people can then choose whether they want to go that way or not. But one component of the keto diet is really interesting, and that's the fasting part. There are many different ways to fast. Remember that by definition, fasting is choosing voluntarily to forego food or calories for a specific period of time. So let me cut to the chase and tell you where the data look most intriguing. The first is what's called time-restricted eating. There's only one study about this, but the details of it were so compelling that I think it's worthwhile because why? We can all do this without making it very difficult on ourselves. What they did in this study is they followed women with a history of breast cancer out for a number of years, on average, a little over 7 years. And they asked them on a regular basis to fill out a food diary. What had they eaten in the past 24 hours and when had they eaten? So the question wasn't so much what they ate as when they ate it. And what they found was that for the women who compressed the period of time each day that they ate to 11 hours or less, in other words, they fasted for 13 hours a day, they actually, on average, reduced their risk of recurrence by about 1/3 and also reduced the risk of ultimately dying from a cancer-related disorder by over 25%. Now, that is what's called an observational study. They took a look and they gathered data and then they watched people over time. They didn't actually create an intervention. They just saw what people did and then offered that information. But what's intriguing about this is doable for any of us, and I actually do it on a regular basis. We call it time-restricted eating. And the way you do this is you try and eat the majority of your calories, the majority of your food, earlier in the day. So let's say that you finish eating dinner at 7 o'clock. What it means is that over the next 13 hours, you would stay hydrated, but you wouldn't take in any calories. And the nice part about that is the majority of the fast takes place while we're asleep. So it's relatively easy. It's just cutting back on some of that mindless eating that we'll sometimes do while watching Netflix or whatever it is we're doing if we're bored or we're upset, or we reach for something just to feed ourselves, even though we're not hungry. So the 13 hours can be, right after you finish dinner, drink water, stay hydrated. The majority of that fast takes place while we're asleep, and then you break it when the time is appropriate, 13 hours later, after your last caloric intake with breakfast. The interesting thing here is, what does that do? Remember we talked about sugar before? It brings sugar levels down. It brings insulin levels down. It brings those inflammatory compounds down. It brings IGF-1 levels down. It's been shown to help people lower their blood pressure, lose weight. But here's the intriguing thing, beyond reducing inflammation and all, it also has been shown to help people sleep more soundly. And there are some research experts who think that that might be why it helps keep cancer at bay, because it helps us rest more soundly and helps our body to get back into that space where it's not having to use energy to digest food while we're trying to sleep, but it can use that energy in order to restore our health. So time-restricted eating is one way to do it. And you'll read all kinds of programs about this. There's a 16-8 program where you only eat 8 hours a day and you fast 16 hours. There's, there are all different ways of doing this. But what's interesting is it looks like if we're only fasting for 12 hours of the day, that may not be enough. So the floor looks like 13 hours. And it's doable. Think about it. If you start breakfast at 8 in the morning and you finish eating at 7 at night, you can still eat all the food that might be healthy for you at almost as much as you like, as long as you're keeping that period of time where you're fasting to 13 hours. We're going to be waiting for more research data, but that's something we can do, and I do it on a consistent basis, to be honest with you. Now, on a Friday night when I'm going out with my family, might I have something at 9:30, 10 at night? Yes. In which case, I say I had a good time with my friends and family. I broke my fast. I can start my fast again later on in the week. Please, if you break the fast or something like that, it's okay. It's not meant to be hard and fast rule. This is something you can do intermittently. Speaking of intermittently, there are all different ways to fast. You could do an intermittent fast of, let's say, cutting back on calories tomorrow by, let's say, a half or a third, and the next day going back to what you normally eat, and the next day cutting back a little bit. That's called modified alternate day fasting. There's all different kinds of programs here, but the one that also looks really intriguing because it's doable, it's what's called a fasting mimicking diet. This is a program of 5 consecutive days done once a month, each month. Again, the research here is in its infancy, but it looks very interesting and it's doable. So here's what it looks like. Remember, 5 consecutive days. Day 1, cut back what you normally would eat by 50%. Let's say the average person takes in, let's say around 2,000 calories. On the first day of the fasting mimicking diet, we're going to take in around 1,100 calories. You don't even have to count calories. Just cut everything in half that you would normally eat. Days 2 through 5, cut back from what you normally would eat by about 2/3. The idea is to get about 1,100 calories on day 1 and only about 700 calories on days 2 through 5. Now, let me share with you that when I first heard about this, I'm thinking, I like food and I enjoy eating. And so cutting back by a half or 2/3, that doesn't sound like fun. And I probably am not going to think very well. I'm probably not going to have a lot of energy. I'm probably going to be dizzy, all these kinds of things. So you should know that on day 1, you might actually feel some of those things. You might feel a little bit less energy. You might feel a little bit foggy. But by day 2, it is weirdly extraordinary that you actually might have more energy and you might be thinking more clearly. This has been written up over and over again in research trials, but I can tell you also, I was very skeptical, but I experienced that as well. So it's something that you could try. Now, any of these fasting programs are not for anybody who is having difficulty maintaining a healthy weight. What I mean by that is that if you have lost a lot of weight or are continuing to lose more weight than is healthy for you, fasting is not the way to go. This is a program, these programs for people who are able to maintain a safe and healthy body weight for their height, or who have gained weight and are looking for a way to lose it. Why? Because that 5 consecutive days of the fasting mimicking diet has been shown in a 3-month trial in just 3 months, so a total of 15 days, to help people lose weight, lower their blood pressure, and reduce inflammation and enhance sleep. Pretty good. And it's doable. It's really not that hard. So let's say you get to day 3 and it's just feeling hard and you're just hungry and you're kind of hangry and all that kind of stuff. It's okay. Break the fast. You don't have to stick to it unless you want to. So these are all different things we talk about with regards to food that are options. But the key is whatever program you go into, make certain that you enjoy the food and that it's something that you can stick with, and that every once in a while you throw in that crazy splurge that you know may not be so good for you, but is good for your spirit as well. Whenever we talk about diet, we talk about exercise. It is the single best stress buster and the single best anti-anxiety, antidepressant activity that we know of. No pill comes close to what exercise can do for our moods. So of interest, you might ask yourself, well, how much exercise do I need? I got to do 30 minutes, I got to do 45 minutes, I got to do 60 minutes. What's the least I might be able to get away with and still get a benefit? The answer is 15 minutes. 15 minutes of a brisk walk, enough to get a sweat going, but not enough that you lose you're getting short of breath or can't hold a conversation, is a great way to get your exercise program started. Let's say you're just getting started and you're not in the shape that you want to be. Beyond the wellness programs that are available at Novant and at LCI, which are wonderful programs, if you want to do some of this on your own, you could do 5 minutes of walking in the morning. You could do 5 minutes in the afternoon. Maybe do 5 minutes with friends or family in the early evening. Because as long as it adds up to that 15 minutes, you're going to get a health benefit. As you start building your stamina, you might even throw in a little bit of an interval. So let's say you're walking for 15 minutes gently. Let's say you walk for 4 or 5 minutes, get warmed up, and then for the next 30 seconds, you're just going to walk just a little bit faster. And then after 30 seconds, you slow back down for a minute, And then for the next 30 seconds, you walk just a little bit faster. Those intervals actually trick the body into thinking that we are exercising for longer periods of time. And we get real health benefits from that. But again, remember, you want to, whether it's yoga or walking or Tai Chi, you want to have it individualized for you, which is why working with the wellness centers, working with the rehab centers where they have fitness experts that can work with you based on what your experience has been and help you to stay healthy and not hurt yourself is really important. I'm a big fan of yoga, a big fan of Tai Chi, but I recommend working with people who are well trained in this space because you don't want to hurt yourself. And that's why oftentimes with yoga, what I recommend is working with a yoga therapist first, a one-on-one session, either by video or in person, so that they can create an individualized program for you so that when you jump into a yoga class, you're not going to be treated like everybody else there. And so if downward dog hurts your wrists, there's another pose that you can take that's going to be good for you. And when they jump up into something else, then you join the class again. Make it work for you. But one of the best exercises you can participate in is walking. And do it outdoors and do it with a friend, maybe 6 feet apart, but getting outside and spending some time getting that vitamin D can be very good for you. So speaking of vitamin D, let's talk about vitamins, supplements, and herbs. Believe it or not, there are estimates that there are somewhere between 70 and 80,000 different vitamin, supplement, and herbal products out there. My team and I, we actually have faith in about 20 to 25 of them. So when you're going out there to the health food store and saying, well, I heard vitamin D is good for me, but here's vitamin D2 and here's vitamin D3, and this one comes in a liquid and this one comes in a pill, and this one's got magnesium with it, and this one has zinc with it, and this one has K2 with it, and what do I do? And so one thing I want to make certain that you know about is we are very, very fortunate at my institution to work with an extraordinary pharmacist named Kim DeRodes. Kim is a conventional pharmacist, has worked in hospital pharmacy for over 30 years, but she's also one of the very few pharmacists in the nation who knows vitamins, supplements, and herbs cold. And the reason why I can say in the nation, back in 2017, Dr. Andrew Ryle came out with a book called Mind Over Meds. And the idea behind this was to point out where prescription medications are really good for us, but to understand that the very first thing that should come out of a doctor's pocket should not be this prescription pad. And there was only one person he invited to participate in the writing of that book, where they wrote their own entire chapter, and that's our pharmacist, Kim DeRodes. She is excellent. And so she does what's called a medication therapy management session, an MTM, where she goes over your prescription medications and any vitamins and supplements and herbs that you're already on, and any that might be good for you, while making certain to avoid interactions that might be harmful. So as an example, when I was in training, one of the first people I met was a 50-ish-year-old gentleman with a family history of heart disease. He wanted to make certain he wasn't going to get a heart attack. And so he was eating a healthy diet. At the time, this is in the late 1990s, he was taking vitamin E every day to try and fight off a heart attack. We know that actually that doesn't work very well. He was taking an aspirin every day to try and fight off a heart attack, and we can talk about that. He was eating a clove of garlic every day to try and keep his cholesterol down. And he was taking ginkgo biloba every day to try and remember to do all the rest of this stuff. Now, that all sounds fine, except every one of those things is what's called a platelet activating factor inhibiting agent. In plain English, it increases the propensity towards bleeding. So if you are working with a healthcare practitioner, a physician, that you don't feel like you can talk to about vitamins, supplements, and herbs, the challenge there is that if you read on Dr. Oz's website or in the latest magazine or on the internet that you should take this particular herb and you don't tell your doctor about it or your pharmacist about it, you might actually do harm to yourself. So in that space, when we are talking with people who are going through treatment, who are receiving chemotherapy or radiation therapy, we ask them not to get their antioxidants from supplements, to get their antioxidants from vegetables and fruit. Because the amount that you get from vegetables and fruit is so much less than in the concentrated form of that vitamin, supplement, herb. And there are theoretical concerns that antioxidants and supplements might actually interfere to some degree with chemotherapy and radiation therapy. But to get it from your fruits and vegetables, that's actually beneficial for you. So a couple of vitamins and supplements and herbs just to keep in mind. We like vitamin D. Remember, we said get outside, get some sunshine, but our dermatology friends don't really like that very much. So we recommend that you put sunblock on your face and on your hands to keep wrinkles at bay. Get outdoors for about 15, 20 minutes, get some sunshine, then cover up, use up that sunscreen, but take a vitamin D supplement as well. And the only precaution here is if for whatever reason you have high calcium levels. Vitamin D helps with calcium absorption, so you may not want to take vitamin D. You just got to talk with your doctors about that. There's vitamin D2 and there's vitamin D3. Both can be beneficial for you, but vitamin D3 is better utilized by the body, so we recommend taking vitamin D3. On an everyday basis, we figure that people should be taking somewhere between 1,000 and 2,000 international units, IU, of vitamin D3. If it's been a long time since you've been outdoors, if you haven't been taking vitamin D, you might ask your doctor to get a vitamin D level drawn. Excuse me, when we get vitamin D levels, the reason we do this is because we want to make sure that the level is not super low. Most labs will say anything above 30 is normal. We like to see your level between 45 and 60, no higher than 70. If it's, let's say, in the teens, I said take 1,000 or 2,000 international units a day. If it's in the teens or less than that, we're going to recommend 50,000 international units IUs once a week for 8 weeks, recheck a vitamin D level, make sure it's come back up over 30, and then ask you to take 1,000 or 2,000 international units. You will read about things like medicinal mushrooms, many of which we are big fans of. There's one that's called turkey tail, another that's called reishi, one that's called maitake. They all have been used in Asia for a long time and look quite beneficial. We use them during treatment and beyond treatment. If you like eating mushrooms, best to eat shiitake and maitake mushrooms. Regardless of what type of mushrooms you like to eat, do not eat them raw. So like when you're at the salad bar or things like that, and you got all the button mushrooms or even portobellos that are raw, only eat cooked mushrooms. Because number one, to get the benefit, you have to cook them well enough in order to break down the cell walls and get to the health promoting compounds there. But some raw mushrooms may not be beneficial for us. So if you're going to get mushrooms, make certain that you cook them. Other supplements that people talk about are things like turmeric. Turmeric is a spice, but it also comes in supplement form. And turmeric is really interesting. It's related to ginger. It's an anti-inflammatory agent. It's a potent antioxidant, but it also has some quite significant anti-cancer activity. Now, I mentioned before that it's an antioxidant. So we don't recommend taking it during treatment, but we recommend taking it for a while after treatment if you like. There are many other agents out there. Astragalus, there's something called vitamin K2. There's a lot of different agents out there. You don't have to take a whole bunch of them. Focus on the ones that look like have the best evidence behind them, and then look for products that are actually made by a quality company. How do you figure all that out when most physicians don't have training in that? Number one, you could go visit with Kim, but an easy way you could do it from home is that this is something I would ask you to write down because it's a very good resource. It's called Consumer Lab. Consumer Lab is a website you can go to. It costs about $40 a year to join, but I think it's a good investment in your health. Why? What does Consumer Lab do? They go out and they take bottles off the shelves and then they evaluate it to see if what's on the label of that bottle actually matches what's inside the pill. It is still a buyer beware market when it comes to vitamins, supplements, and herbs. And so to have a resource that will point us in the way of quality product for vitamins, supplements, and herbs makes a lot of sense. So consumerlab.com is something we recommend highly. I use it myself. If you are interested in perhaps something like astragalus or turmeric, it will point you in a good direction, but also let you know when not to use it. So as an example, turmeric is like aspirin. It thins the blood a little bit. So if you're taking turmeric and fish oils and ginger and aspirin and you're bruising easily, we probably need to get you off some of those things. And we certainly want to get you off of those things prior to any kind of surgery or anything of that nature. So there's lots out there, but I would also ask you to keep in mind there's a lot out there that isn't good for you. So when you start reading about things like vitamin B17 or amygdalin or some of these different agents that are out there that like ozone therapy or things like that, we do not think are safe for you. And so it's part of the reason why, whether you're going to Levine Cancer Institute or you're coming to Novant Health or you're going to Wake Forest, we don't care. We just want you to be well. So when you're taking vitamins and supplements and herbs, make sure to share that with your doctor so we can at least work together to make certain that you stay safe. That's the big thing. Because remember, if something has an action in the body, it could equally have an interaction in the body too. So let me close by talking about one of the most important things that we can do to take care of ourselves. It's hard enough to face the COVID crisis. It's hard enough to face just daily life. It's hard enough to take care of our loved ones and our family members. But then you put into that the curveball of a diagnosis of cancer and treatment, and now trying to take care of yourself and trying to manage fear and anxiety. It's a lot. So let's go back to that early phase when we talked about kindness. I know it doesn't sound medicinal, it doesn't sound medical, but I'm convinced that it is. It starts with realizing that these are stressful times, and with all that you have been through, it behooves you to create a little bit of a cushion to take a little bit extra care of yourself. Not from a place of selfishness, from a place of self-sustainment, so that you can continue to do your good work for a long time to come. And that can take all different kinds of forms. Maybe it's watching comedies on a regular basis. In my family, we like The Simpsons. It might be getting together in community like this. It might be listening to music that calms you. It might be attending services or gazing at the stars. It might be meditation. There's all manner of ways to manage stress. Interestingly enough, in the corporate arena, the number one way that corporate people manage stress is they go back to work and they put in more hours. And it's interesting because it's not healthy for us to do that. Because what it's been shown is we become less and less efficient doing that. But what is good for us is to take time for ourselves. So I won't ask any of you to stop, but I would ask you to create time in your week to pause. Remember, there's a big difference between sleep and rest. Sleep happens when we're asleep. Rest happens when we are awake. And one of the best guides I can offer to you is simply because I have done this in my own life, is to create Sabbath space in your weekend. What I mean by that is create a period of time, no shorter than 3 hours, where you guarantee yourselves you will do no work. That includes no housework. That includes no laundry. That includes no bills. That includes no work from the office, anything. It is time for you to keep unscheduled and do with whatever you like. The best way to do this is actually to get out of the house. Now, I know in these days it's a little bit hard to do that, but even out into your yard, out into the driveway, out on your deck, whatever, to get a little bit of sunshine and fresh air. If you are in a family, have a significant other or children, the way you can do this is this Saturday or Sunday, you take 3 or 4 hours. The next Saturday or Sunday, offer the 3 or 4 hours to your significant other. And the following Saturday or Sunday, take the 3 to 4 hours together as a family and then start over again. What do you do during those 3-4 hours? Anything that feeds you. Call a friend you haven't seen in a long time. Watch a movie, take a nap, read a book, take a yoga class, but don't schedule the yoga class. Make it spontaneous. You want this space to be unfettered, free, unscheduled, to do it as you like. As time passes, build on that. Add another hour, until you finally get to the space where you actually have a Sabbath day, a day for gratitude, a day for forgiveness, a day for peace and wonder and love and all the things that keep us going. Remember, if you and I and our loved ones work 24/7, 365, we are still going to have stuff to do. Our to-do list is going nowhere. So it behooves us to not run on reserve energy, but to actually put some of that energy in the bank. Create a little bit of space to pause, not stop, but pause so that you can actually fill your reserves just a little bit more to continue your good work with everything that you are doing. There are many other topics we can touch on. How do you get adequate sleep? What do we do to take care of ourselves when we're 3 weeks out from the next blood test or the next scan or things like that? There are wonderful, wonderful ways of doing this. And much of it has to do with going back to that space of being kind with yourselves. There's some wonderful apps out there right now with mindfulness meditation like Calm and Headspace, many of which right now are offering free guided meditations. There's an app called Down Dog, which is, I think it's still free, but if not, it's pretty inexpensive. Gentle yoga that you can do, but just start with the beginner. Remember that at LCI, at Wake, at Novant Health, we have yoga therapists. We have people who can train you or help you participate in mindfulness meditation. If you've ever met Tai Chi Mike, he is wonderful. He works at our facility. Tai Chi is a wonderful program of gentle moving meditation. We have acupuncture, which is a wonderful way to help reduce pain, reduce neuropathy, to manage insomnia, to help with all different kinds of things. And you remember, if you don't like needles, which many people don't, you can still do acupressure. You want to work, if you like massage therapy, who doesn't? You want to work with somebody who is oncology massage certified. We're not, everybody loves massage envy. It's great, but that's not what I recommend for you. You want to work with somebody who knows what it means to have gone through what you've gone through. If you have had surgery, what areas to stay away from. If there are other areas of involvement, how to take care of that. Where to be a little bit more forceful, where to be much more gentle. So look for those massage therapists that have oncology massage certification. Again, I'm sure LCI has it. I know Novant has it. And there are people in the community that have it as well. So these are the kinds of complements to care that we're talking about. We're big fans of conventional medicine when it is appropriately applied, but we're really big fans of you taking advantage of what you were born with, those innate gifts of healing, and how might we support them to work well with conventional medicine to keep this illness at bay and to help you find that wonderful quality of life, pain-free quality of life, peace of mind quality of life that you deserve and that you can participate in. Remember these things we're talking about here. That's a lot of information we talked about. Don't do everything. If all that you do is say, well, maybe I'll talk with my doctor about taking vitamin D. Great start to a program. Maybe I'll take a look at this Healing Kitchens program. Great start to a program. You know what, maybe the next time I meet with my doctor, I'll tell them about all the vitamins, supplements, and herbs that I'm taking so I can stay safe. Or I'll meet with Kim, or I'll join Consumer Lab. It could be any of those types of things, but be gentle with yourselves. Just the fact that you are here sharing time with me in community like this is really great because it means you're engaged in your care, and that's what we want. We want folks who are going to ask the questions, who are going to take a look and find information that is actionable but not overwhelming, and will participate in ways to stay healthy in all ways for a long time to come in a way that is reasonable, in a way that is rational, and in a way that is actionable, and that actually helps us feel better as well. I have spoken for way too long, so I want to be able to answer your questions. So either send them in the group chat, or go ahead and we'll take you off mute. We'll take as many questions as you guys have. I see one of the questions was, Rebecca Katz, is she the wife of David Katz? No. David Katz is another gentleman who focuses a lot on preventive medicine. He's not an integrative medicine doc, but he focuses on prevention. Rebecca Katz is a chef. She's not even a nutritionist initially, but she started by because her dad became ill with cancer, and nobody could figure out how he should eat. And she was like, this is crazy. This is nourishment. This is sustenance. How can there be nothing about this? And, unfortunately, many of my colleagues, oncologists, say, just eat. We need you to get calories. That is not the right answer. Mm-hmm. So Rebecca went out and actually became more of a nutritionist because she knew that needed to be done so that she had credibility, created these recipes. She also has a soup cookbook and all, but then she created this specific program for people with a history of cancer, and you don't have to follow it word by word. And the videos, again, it's all free. You don't have to go in order. You can jump around. See, I want to look at that video. I want to look at this video. I'm going to look at this recipe. make it work for you. It's a very good resource.
Thank you.
I see that Cynthia Brooks has a question.
Yes, I do. We touched base on people who have wanted to lose weight and doing certain things. What about people who's lost weight, who need to put some weight on? Like, I'm a newly diagnosed person for the breast cancer, and I have lost weight because of the stress.
Yes.
Although I haven't started the treatment yet. I don't start the treatment, I guess, until the end of the month when I go in. So my question is, what can I do to kind of gain some more weight?
So it's a really good question. And, it's from the folks that I have the opportunity to meet with who are in that space, it is often, and I hope it's not this way for you, Ms. Brooks, but it's also often very frustrating for folks because everybody's trying to lose weight. And here, we have people who have lost weight and are trying to figure out what's a healthy way to gain it back. I don't want to be just eating potato chips and things like that.
Absolutely.
So the first thing I would recommend, Ms. Brooks, is honestly, it doesn't matter which institution you're getting your healthcare at, you're going to be able to find good nutritionists who will be able to guide you. And the reason why I say that is I can speak with you all day long about why extra virgin olive oil is good for you and what about soy and why organic. But if you were to ask me, Russ, what should I have for breakfast tomorrow? It's like, and this is where working with a nutritionist, especially if you have family living with you and all, how do you make this work within a family in a way that is tasty and delicious and can help you gain weight in a healthy way? Because remember, healthy fats like extra virgin olive oil, omega-3s and things like that, they're going to help with weight gain and they're good for you.
Okay.
Is there a way that we can mix that in with stuff that's really tasty, but that also keeps you away from some of the stuff that might not be good for you? And some of it, one of the other reasons to meet with the nutritionist is because depending on what the treatment is for you, we want to make certain that we can have the diet go along with that treatment and support the treatment. Make certain that it's not, again, one of the very, very hard to follow diets out there like Hallelujah Acres or Gerson or things like that, which I do not agree with. To make it reasonable, rational for you, supportive for you, and also enjoyable. So that would be my recommendation. If you're looking just for some general guidance about what an anti-inflammatory pattern of eating looks like, again, my teacher, Dr. Weil, it's spelled W-E-I-L. He actually has a website, Ask Dr. Weil, or just drweil.com. And on that website, you can find out what goes into an anti-inflammatory diet, what are some of the recipes, things like that. But again, I will be in touch with Leslie. I'll give you the free sign-in for this program. As far as I know, they're not collecting data on any of us. I mean, I go to the website as well. It's very good information. I hope that'll be good. But most of the nutritionists in town also really like the website. And so they can work with you, Ms. Brooks, to develop an eating program that actually you can still use some of the videos and things like that.
Oh, I would love that. Thank you so much.
Oh, you're welcome. And good luck with treatment. And again, Wake, LCI, Novant, we all have integrative medicine programs. Go meet with the folks because you can gain access to some of these different treatments that can help you during treatment and beyond.
Okay. Thank you so much.
Oh, you're welcome.
Dr. Greenfield?
Yes.
My oncologist is at Levine, and my internist is at Novant. And my internist recommended that I go to your integrative medicine clinic.
Yeah.
And I was immediately connected with Mavi.
Wonderful.
And she immediately connected me with Kim and connected me with Katrina.
Great.
And also the Cancer Fighting Kitchen.
Yeah.
And I can't say enough positive things. Kim particularly really helped me with taking the right supplements and looking at my meds and looking at my supplements and helping me along with that. Mavi, so encouraging in that from the very beginning. I mean, after 2 weeks after I was diagnosed, she told me like different paths I should be thinking about. But like the last time I talked to her, her number one thing was, you need to have some pauses in your life. You need to give yourself the rest time, like you're talking about. Give yourself 30 minutes of doing nothing. And I find that very hard, but I'm working on it.
Well, first of all, thank you for this, because Madhvi is a dear colleague. She's our physician assistant. I also work with another physician. Her name is Lisa Jervis. She's an integrative physician, but with a background in OBGYN. And so we have a lot of folks that can, address different issues. And Madhvi has been actually working in oncology as a PA for many years. And again, Kim can help with those vitamins, supplements, and herbs and things of that nature. So I'm just really glad that you had a good experience with her, and I'm really glad that it was a benefit.
Well, Katrina actually called. We had a long before the COVID-19, like months, 3 or 4 months before. We had like a phone conference, and I thought, like how helpful can it really be on the phone? I was thinking I really would like to meet with somebody one-on-one and talk to them, but it was like when I hung up, I learned so much from that phone conversation with her. It was as if I was just meeting with her. So if you should sign up for seeing her as a nutritionist, don't be thrown off by the fact it's just a phone call, because it's a lot more than just a phone call. Okay.
Super. Thank you so much for saying that. Thank you. Yeah. Let me take a look at some of the stuff that's written here. So one of the questions about, eating sugar on a consistent basis and how to manage that kind of thing. And so remember, most any food that we eat, even if it's protein, even if it's fat, at some point can be turned into sugar in our body. That doesn't mean it's bad. It just means that the body needs it. So what I'm talking about is staying away from some of the really highly processed foods on a relatively consistent basis. So as an example, intriguingly, most people think that breakfast cereal is really good for you. As it turns out, most breakfast cereals are actually not very good for us. They're even if they're oats, they're rolled oats or smashed oats, and those kinds of things are actually, again, a high glycemic index food. They increase inflammation. So oatmeal and berries and things like that are a little bit better. Again, every once in a while, cereal is okay. But, so the sweets that we all crave and love, the chips and things like that, what I'm just asking is try not to eat something like that every day. If you can treat yourself, start out by doing it every other day and then spread it out a little bit more. One of the best things that you can do if you like soda, try to give it up. Especially the high test stuff. So, diet soda is still not very good for us, but at least it's not providing us with what we term empty calories, which is just, interesting enough. Yeah, I don't know about you. I grew up, a day without orange juice is a day without sunshine. But as it turns out, orange juice, not very good for us. It's essentially equivalent to drinking soda because all that it is drinking a lot of sugar. So if you like juice, what I recommend is put it in a lot of sparkling water or a little bit of water just to give it a little bit of flavor. Put a little bit of juice in. If you like cakes and cookies or things like that, there's part of the joy of life. Maybe have a little bit. We tell folks, dark chocolate is good for you. It's true. Don't eat the bar every day. Eat a little bit each day because it's good for you. But, if you can make it more of a splurge, your treat, rather than eating on a consistent basis, it's going to be better for you. So again, sugar's not evil. It's just try to make it an every once in a while thing. If you like sweetened beverages, maybe you might try stevia or Truvia. Stevia is an herbal sweetener. It's very potent, so you don't want to use much of it. It also tastes a lot like licorice, so some people don't like that taste, but Truvia is a product that mixes stevia and something called erythritol. It's a sugar alcohol. It doesn't cause your blood sugar to go up, and it doesn't create that licorice-like taste, and yet it still tastes relatively sweet. That question reminds me of one other thing. A lot of people say you can't eat pasta. Pasta's bad for you because it causes your blood sugar to go up and stuff like that. It's actually not true. If you cook your pasta al dente. What I mean here is it doesn't matter if it's whole wheat pasta or semolina pasta. If you cook it only 6 to 7 minutes with a little tooth to it, al dente, it becomes a non-high glycemic index food, meaning it doesn't release sugar into the system as rapidly, doesn't cause big sway in your insulin levels. So cook, if you pick, semolina pasta, cook it for 6 to 7 minutes. Add some extra virgin olive oil, tomato sauce, some veggies, some healthy protein in there. You have a very good meal that can be quite delicious.
Let me help you with the chat, Dr. Greenfield, so we can get through the chat questions, and then we've got some hands raised also. Laura Miller is asking, what are your thoughts on green tea ECGC supplements?
Awesome question. We're big fans of green tea, not fans of green tea supplements. So green tea contains something called EGCG, which is, it's a long-term, it's called epigallocatechin gallate. And EGCG looks like it has a lot of really good actions in the body. It can lower cholesterol a little bit. Something that comes along with green tea called theanine can actually relieve some anxiety. It may even help with a little bit of sleep. But EGCG is also a potent antioxidant, and it has anti-cancer activity. Drinking green tea, we're big fans of. Unfortunately, green tea supplements, some of them have been tied to liver damage, and some of them have been shown to actually increase estrogen levels in the body. So all in all, we don't like green tea supplements, or if it's mixed in a supplement, but we love when people drink some green tea. Now there's green tea and there's green tea. So Lipton green tea is, it's just okay. But if you really want some green tea, you want to get some of the good stuff. And that usually means Japanese green tea. So we're talking about things like matcha. Matcha is spelled M-A-T-C-H-A, like match with an A at the end. Matcha is actually a powder. And so you take a little bit of the powder, mix it into the hot water, and it's one of the few green teas where you actually can drink the leaves. If people like tea with a little bit of cream added in there, you actually don't want to do that for health benefits, because it actually acts against the EGCG and some of the other components in the tea. But if you like a little bit of lemon juice with your tea, it actually enhances the health benefit of green tea. So drink your green tea with a little bit of lemon juice, just a little bit. Tastes better, doesn't taste quite so much like grass, and it has some health benefits for you. Drink a mug, maybe 2 mugs of green tea a day for health benefits. You don't have to worry about the antioxidant content if you're in the midst of treatment, because again, you're not taking it in supplement form. You do want to be careful with green tea in the setting of receiving something called Velcade or a medication called Sutent. These are 2 agents that are used oftentimes in something called multiple myeloma. But if for some reason that is brought up for you, green tea actually interferes with those 2 chemotherapeutic agents. Again, one is called Velcade, the other is called Sutent. This is a ton of information, and that's why I share with you guys. Talk with your doctors, come meet with Kim, look up the information on Consumer Lab so that it's not overwhelming. Come meet with me, go meet with Chase Bailey Dorton, go meet with some of the other. We don't care, we just want you to be healthy. That's all we care about.
Another question that Stacy Ebersol has is, what suggestions do you have for managing hot flashes?
We get this question quite a bit, and hot flashes are really problematic, so are things like neuropathy and things of that nature. The number one thing that I have seen people benefit from, remember, nothing is 100%, but this is way over 50%, is acupuncture. It often works really, really well. Now, what typically happens when you go into, remember, there are chiropractors that offer acupuncture, there are physicians that offer acupuncture, there are massage therapists that do acupuncture. In this regard, I'm a little bit snooty. I recommend meeting with a traditional Chinese medicine practitioner, a TCM practitioner. Somebody has gone to a school of Chinese medicine. They don't have to be Chinese themselves, of course, they just have to have gone to a school like that. So I know at Levine they have an acupuncturist who's trained that way. At Novant we do. At Wake they do. And there are people in the community that we recommend going for as well. The downside of acupuncture is it is rarely covered by insurance, and it can get expensive. A typical first visit is somewhere between $100 and $125. A typical follow-up visit is somewhere between $70 and $80. And it usually takes at least 5 to 6 sessions to even get an idea of whether acupuncture might be beneficial for you. On the upside is that you can find some groups that offer what's called group or community acupuncture. We're going to be offering that at Novant starting later on in the year. It's where you actually go in and you're with 4 or 5 other people sitting on like a lounge chair. You don't have to get disrobed. Only the front of the body is treated. And it seems to work just as well as if you were completely disrobed and treat the front and the back of the body. And the cost is about 1/3 of what it would normally cost somebody for going in for a one-on-one. At Novant, the other thing that we offer is that if you are a Novant patient, your first session with the acupuncturist is free of charge. We actually offer the same thing with our oncology certified massage therapist, who also gives classes in aromatherapy and things of that nature. So we're big fans of acupuncture. You will read for hot flashes about something called black cohosh. It's an herbal remedy which has been studied and looks quite beneficial. There were some concerns that black cohosh might have some estrogenic activity, but that has been disproven. Black cohosh looks safe. It doesn't work for everybody, and we only have safety data out to about 6 months. So that's part of the reason why I recommend acupuncture more, because if it works, after those first 4 or 5 sessions, the acupuncturist can start cutting back on the number of sessions that you need. It doesn't cost quite as much. You can learn some acupressure that you can do on your own. There's a lot of different ways to do that. And then it's just taking advantage of, again, what you were born with, because that's what acupuncture is about. It's about balancing our chi, our life force energy, so that we can be in the place where our bodies can heal themselves and manage the hot flashes themselves. Same kind of thing with neuropathy, that unfortunate side effect that happens with some chemotherapies of burning and tingling and just discomfort in the hands and feet. It often goes away on its own after a period of time, but it's very uncomfortable for a lot of folks. Acupuncture can be very beneficial, but a really inexpensive way that often is beneficial for folks, believe it or not, go to your pharmacy and pick up a 1% menthol cream. 1% menthol has been shown to be very effective when applied topically. Remember, this is a topical application. When applied to your hands or feet, if you have some of that neuropathy. You do it twice a day, and you do it for a couple of months, and it seems to work quite well. There are other things. There's something called pentyl ethanolamide. There are some other agents that we sometimes recommend for folks. Some people, after treatment, we use alpha lipoic acid. That is something that's been studied in the setting of diabetes and neuropathy, but it can be very beneficial as well. So there's lots of different ways to do this. Don't think that you have to live with the side effects. There are ways to manage these side effects, and hot flashes is one of the more bothersome amongst folks, and you can help manage that oftentimes with acupuncture and some other ways as well.
Charlene Jackson has a question. You mentioned more vegetables than fruit. What is an adequate amount of fruit to eat daily?
So, you will read about different things like cups of this and cups of that. I just think that's too much. Eat a little bit of dark berries each day. That's what I would say. Add some blueberries to your oatmeal, or if it is a breakfast cereal day, add some blueberries in there. Maybe add some to your salad. If you're creating a smoothie, berries are wonderful things to add in there. And so sometimes, like if you're making a smoothie, it'll say like use half a cup or something like that. Follow the recipe. That kind of stuff is great. But it's not like you have to eat them all the time. And if you don't like berries, it's really okay. You don't have to eat them. But they do have some health benefits. And so adding them to your foods and things like that can be a very beneficial thing. And they add a healthy bit of sweetness to our diets. I want to go back to one thing I was thinking about, specifically around vitamins, supplements, and herbs and spices. And we talked about turmeric being something that can be very beneficial. Research came out about 2 years ago that if you are taking tamoxifen, there is a chance that turmeric may interfere slightly with tamoxifen. And I do mean slightly. It may reduce what's called the availability by about 10%. Now, is that clinically relevant? We're not sure. But we say, why take a chance? So if you're taking tamoxifen, don't also take turmeric. If you are taking an aromatase inhibitor, the other kind of medication that is often recommended in estrogen receptor breast cancer, you don't have to worry about taking turmeric. It's only if you're taking tamoxifen.
Ann Nelson has a question. Would you have any nutritional or supplementary recommendations for MTHFR double genetic mutations?
So MTHFR is something that's come onto the scene probably over the past 7 to 10 years. And this is it stands for methyl tetrahydrofolate reductase. That's why they say MTHFR, because it's so much easier to say. And there are some people who have a genetic variant of that. And where it has been perhaps best studied is in the setting of depression. Some people who are MTHFR variant and take an antidepressant and are not getting better, it may be because of that variant, and we may have to use some form of supplemental vitamin B6. But there's all kinds of information out there on the internet saying, well, if you have this variant, you might be more susceptible to this, and so you have to take this supplement, or you might have to do that. To be honest with you, the research is not yet there to say that most people need to supplement with something, even if they have the MTHFR variant. One of the challenges with getting many of these blood tests out there with functional medicine, things like that, let's say the test comes back abnormal. Oftentimes we're stuck with, well, what do we do with that result? And that's part of what has happened with the MTHFR variant, is that we recognize it. More research needs to be going on to say, do we need to do anything about it? But actually right now, there isn't enough research out there to say that you need to supplement. Certainly you could take a B complex or a B50 or B100 and get a little bit more that way. Some people actually take a specific supplement for the MTHFR reductase variant, and maybe that's beneficial overall. But we don't have enough information right now to say that if you have that, you must supplement. The information out there on the internet about this is way ahead of the research. So for most folks, unfortunately, the test comes back that way, and now we're worried about it, but we might not even have to worry about it because we just don't have enough information about it.
Okay, and Ann has one more part of her question, and then I'm going to get to Tammy Griffith. Ann wants to know regarding insulin, wait just a minute, regarding, my screen just moved. Regarding insulin resistance, if you eat healthy, is there a way to get back to your normal level, or are you headed toward diabetes and it's not reversible?
So it's a very good question. Thank you. So most people with what we call type 2 diabetes, what used to be called adult onset diabetes, but now lots of kids have it as well. So it's type 2 diabetes, and that's where there is enough insulin in the body, but the body is just resistant to it. And that sometimes is due to eating all those high glycemic index foods that cause the blood sugar to go up so much, and our insulin, we need more and more and more and more insulin to get that sugar into cells, and we just become resistant to it. And that's where medications like metformin and things like that come into play. But that's also where changing our diet comes into play, because just as you brought up so nicely, if we change our diet, if we eat a little more healthily, if we're getting a little bit of exercise, if we're managing our stress, all those things, and managing our stress in healthy ways, all those things help to bring insulin levels and insulin sensitivity back towards normal. Now, you only have so much control, but if you start eating a little bit more healthily, maybe if you are a little bit overweight, maybe looking at time-restricted eating, or even that 5 consecutive day a month of fasting mimicking diet, and healthy ways to manage stress, and getting a little bit of fitness in there. There are data suggesting that you can reverse that, and that you can actually increase insulin sensitivity again. And how wonderful is that, to think that we actually might have a little bit more control?
That's great. That's great. Tammy.
Yes.
Your turn.
Hi, Dr. Greenfield. My question is about the geriatric community. I'm a breast cancer survivor, but my mom is currently undergoing treatment, chemotherapy for colon cancer. I'm really struggling to find resources for her at age 91. Can you make some recommendation, like, you said acupuncture was really good for neuropathy and hot flashes. Can you give me something to
Sure.
look for her? She's being treated at Matthews and Novant.
Sure.
And I just, she's so jealous of me because I have all these resources at the Pink House.
Yeah.
But I'm struggling to find resources for her at age 91 with a different type of cancer than I have.
Yes. Well, first of all, congratulations to you and
you.
to your mom. However, let's talk about ways that we can help her out. So number one is, under ordinary circumstances, to be 91 and have a new diagnosis of cancer, it's hard to get a community going. And then with COVID, it makes it all the more difficult to do that. So making certain that we can figure out a way that she can have support while maintaining appropriate social distancing from her with her friends and with other people in the community, and certainly the love and support from you. So I can only speak to what Novant has available. I'm sure Levine has good things as well. But we have a wonderful, wonderful resource called the Buddy Kemp House. And Buddy Kemp has counselors and social workers. And at this stage with COVID, they can do video visits and phone visits and things. And it's all about, how to manage in this, going through all the challenges of receiving treatment at age 91, asking any questions and not being afraid to mention anything, because these are professionals that can help in that regard. At Presbyterian Hospital in Matthews, just like downtown, just like in Huntersville, we have a wellness center. And so if your mom is up to it and up for it, if she wants to get a little bit of exercise, it could be just walking. She can work with a fitness expert there who will create a program unique for her in community. There will be other people there who are going through treatment, who understand what it means to go through treatment, and that can create, again, enlarge upon her community in that regard. If she is feeling anxiety or stress or things of that nature, some of those apps that we talked about before that are, many of them offering free guided meditations or guided imageries like Calm or Headspace. They're free, some of these guided images, and can help people get to sleep at night. There's a wonderful resource called Health Journeys. And this is not for free, but the information here is about guided imagery. These are basically almost guided meditations, guided imagery by a woman with an absolutely wonderful name of Bella Ruth Naparstek. And Bella Ruth has this wonderful voice that is very calming and can help people who are going through treatment, because they have specific recordings for people who are receiving chemotherapy. They have recordings to help people sleep. They have recordings for people who are having pain, things of that nature. So those kinds of resources are available. The other thing that's happening right now, and I think you're aware of this, is that all of the healthcare systems are starting to open up again. And one of the nice things is that they are being really, really careful about cleaning the rooms and trying to keep people safe. So I know at Novant, for example, we have this thing, if it's green, it's clean, which means if there's a green ribbon around the door handle, the room has been cleaned. But if there isn't a green ribbon there, nobody's supposed to go in just yet, because we want to keep people safe. Everybody is masked, people wearing gloves. So even for the kinds of things where, if your mom is able to travel, if she's able to get to the spaces, she's going to be able to meet with more people in that regard to get access to some of these other things. And then one of the other things that she, again, to make it easy, as I said before, we're big fans of yoga. Anybody can do yoga. And what I mean by that is, I'm not going to ask your 91-year-old mom to do inversions or to hang upside down or anything like that. But there are breathing exercises that she might be able to do. And if she was taught by, as an example, our yoga therapist is in Winston-Salem, but she does video visits with people. And, it could be just that kind of thing of, perhaps not knowing your mom, but one of the most important things is just making sure that she has even connection beyond your loving connection, to make sure that she knows she's not alone in this, that there are all different kinds of emotions and feelings, and there are ways that we can guide her towards doing things that can be good for her, that also might be even a little bit enjoyable and expand upon her community. So maybe it is, the Healing Kitchens program and taking a look at some easy foods that she might participate in. Maybe it is connecting with the Wellness Center and rehab. But some of these same resources that you are partaking of, there's our nurse navigator for colorectal cancer is just a wonderful, wonderful person. She's involved in the Get Your Rear in Gear group and all those kinds of things, where there's a lot of resources there. And so, Ms. Griffin, if I can help you put you in touch with this young lady, she's really, really great. And just reach out to your mom. I really don't care where she gets her health care. I just want her healthy. And then we can hook her up with the nurse navigator and give her some additional resources too.
Perfect, thank you.
You're welcome.
That's great. I can email back and forth between you and Tammy and help with that. Now I see that one of our participants, I don't know a name here, it says G7ThinQ, has a question.
Okay, that would be me. My name is Betty Karima. I'm Ann Nelson's sister, and she had sent me the link for tonight. And I'll tell you, I'm coming up on 6 years, stage 3A lung cancer survivor. I also
Way to
have.
go.
Yeah, thank you. Thank God every day. And I also have the BRAC one like Ann has. So I'm being, watched for that. But when Ann had been talking to me about all the pointers and things, I had already switched from, using sugars to like stevia, the Truvia, but I also switched to almond flour and coconut flour. Can you comment or tell me if that was a good choice, Dr. Greenfield?
Sure. So a lot of people are looking to saying, what do we do about, one of the unfortunate things is, marketing is marketing and advertising is advertising. So many of the foods that we pick up that say, let's say whole wheat or whole grain, you cannot trust that front label. You have to turn it to the back and read, because even, whole grain bread, if you turn it over and take a look, oftentimes the label says, made with a whole wheat. It doesn't say it's made of whole wheat or, stone, wheat or those kinds of things. And so I think almond flour and coconut flour is fine. Do I say that you have to use it? I don't. So if it's easy for you and you like the taste, great. Is it mandatory that you use it in order to stay healthy and things like that? No. Most of that is really more around marketing. But if you like it, it's great. And if the price point is good for you as well, then it's fine. But otherwise, using some of the whole grain flours and things like that are completely fine in that regard. It doesn't have to be just the one.
Thank you so much.
You're
I
welcome.
really appreciate that. Thank you. Oh, tuna fish in a can. Is that okay?
It is.
Okay.
Now, we prefer, if you take a look, the solid white, a lot of people prefer. That may have a little bit more mercury risk to it than the chunk light. But tuna is a good source of protein. Remember that most of the research data coming out about worrying about mercury has to do with the really large carnivorous fish. So it's shark, tilefish, king mackerel, those type of fish that we really want to be a little bit more cautious with because they are going to have a little bit more mercury in them. But even those can be eaten every once in a while. Again, if you're going out to dinner, please just enjoy going out to dinner. And when you come home and buy the kind of fish that you want, that's when you can make those kinds of choices.
Perfect. Thank you very much.
Sure.
We have 2 more questions, Dr. Greenfield, but I wanted to see if you have time for those.
Yeah, I sure do. Please.
Oh,
I want to be of service.
so
I know, if we don't get to people's questions, and people are shy also. And they may have a question they're afraid to answer. That's why you can write it out on the side here. Don't worry about that.
Janet Billings is asking, should those who are ER and PR positive be more careful about consuming dairy?
That's a nice question. So there's all kinds of information out on the internet about dairy and gluten and soy and things like that. And to me, unfortunately, a lot of that is fear mongering. It's like, you can't eat this or you can't do that or whatever the case may be. So dairy is problematic for people who are susceptible to untoward inflammation. Why? Because dairy has in it 2 main proteins, casein and whey. For those who have, let's say, recurrent upper respiratory tract infections or seasonal allergies or irritable bowel or things like that, casein can drive untoward inflammation in the body. But it has never been shown to drive cancerous change. So it's really just taking a look and see how you do with it. I would ask that for people who enjoy dairy, specifically milk in this regard, I would ask that you lean organic. Not so much for the cheeses and things of that nature. For cheeses, you're better off getting the aged cheeses from Europe. So things like Emmental or Gruyere or Jarlsberg, they're going to be a little bit healthier for us than the Crafts of the world and things of that nature. And the hard cheeses are a little bit better for us many times than the soft cheeses. But with regards to milk, remember, if you're getting conventional milk, you are likely getting milk from a cow that has received bovine growth hormone. And bovine growth hormone, some of the remnants of that can get passed on to the people drinking the milk. And there are some concerns that that bovine growth hormone might actually be active in our bodies. And that would not be a good thing. The other thing about bovine growth hormone is that the cows that get it are often more susceptible to getting skin infections. And so they're often given antibiotics, and residues of those antibiotics get passed to us and contribute towards antibiotic resistance in human beings. So if you're going to drink milk, I would rather that you drink organic milk. It is more expensive, but lean that way if you can. People ask, what about whole fat? What about 2%? What about skim? Things of that nature. Remember that fat in and of itself isn't evil. It's just where you're getting it from. So leaning towards the healthier fats like extra virgin olive oil is good for you. There are some people say that a little bit of dairy fat is okay, is a good way to go. So 2% or whole fat if you're only doing a little bit of it. Remember, there's a lot of ways to get calcium in your diet, and it doesn't come only from a milk mustache. So, if you're eating a lot of leafy greens, you're going to get calcium. If you're eating calcium fortified foods, you're going to get calcium. If you're taking a calcium supplement, you're going to get calcium. And so it doesn't have to be just dairy products. Specifically in the instance of breast cancer, there are no data that I am aware of that are convincing, suggesting that you need to avoid dairy. And I will tell you, I really like pizza. So, but I get my pizza with a whole grain crust and veggies on it, or I might try cauliflower crust, which is actually really tasty. But this is why I say, I want a healthy diet for you has to be satisfying, fit your traditions, be delicious. If somebody said to me, Russ, you're doing great, but you got to give up pizza, I would say, thank you, no. But I only eat pizza perhaps once or twice a week. I don't eat the whole pie. I get it with veggies. There are ways to make it work.
That sounds great. That's everything. And this has been so enjoyable. And you just are so calming to listen to and just full of information. And this was an excellent session. Thank you so much.
Thank you very much for sharing your time with me. And, it is confusing and crazy out there. You can get your information from the health food store or the internet or, the magazine or the book. And then can you talk with your doctor about it? It all gets stressful. We want to help relieve that stress. And again, wherever you go for your health care, all anybody cares about is that you get better and that you stay better. So if ever we at Novant, if ever the folks at LCI, if ever the folks at Wake, anybody in the community who I believe to be credible, if they can help you, I am way in favor of you going to speak with them. And just because the folks who do really, really well are the folks who are actively engaged in their care in some way. Remember, I don't want you doing everything we talked about tonight. But if one or two things ring with you, resonate with you, you say, I might try that. Or maybe I'll give myself some space this weekend. Or, hey, maybe I'll try some marinated tempeh in my spaghetti next week. Or, I'm going to drink some green tea with a little bit of lemon. Or I'll try that time-restricted eating. Or I'll meet with Kim. Or whatever the case may be kind with yourself. It really is the centerpiece of staying well. I never got that in med school, internship, residency, 2 fellowships. Nobody talked about that. I learned that from my patients, and I think it's critically important. I thank you so much for sharing time with me this evening. Be well during this COVID time and forever, and I hope sometime we'll actually get to meet in person.